Yesterday, she had to leave that 9/11 commemoration after, quote, overheating. But then her doctor revealed news that she had been diagnosed before the weekend with pneumonia. So what's really going on with Mrs. Clinton? Joining us right now via Skype, Dr. Gerard Gianoli of the Ear and Balance Institute. Doctor, it's our second chance to visit with you about Mrs. Clinton's health. And as we continue to talk about it, we saw that video yesterday. Very shocking. Hillary Clinton seemingly having trouble, her steps, her gait, trying to get into a waiting van. It looked like she couldn't walk. What do you believe this is? Is this a balance issue, or are there more profound implications in your view?
Well, thank you for having me on your show, Congressman. I first just want to send out my best wishes to Mrs. Clinton and her family, and I hope she gets better soon from whatever this is she's dealing with. My biggest concern is not so much what we saw in the video, but what did not happen, which is she did not go to a hospital. And I guarantee you, if I was in that motorcade, regardless of what Mrs. Clinton said, I would have brought her to a hospital, because unless she's had other episodes like this, and this is a recurring thing that they're used to, this was a very concerning event. She was just started on a new antibiotic. We don't know if she was having an anaphylactic reaction to the antibiotics, and bringing her to her daughter's apartment could have been a death sentence to her. So I have some concerns about whether she's allowing the doctors to help her, or whether she's just ignoring their advice, or what have you. But this is not what you typically see from somebody who has pneumonia. Antibiotics don't help a condition like this. I mean, she looked like she was having some event where she lost all tone in her muscles. Could it have been she was just hypotensive? That's certainly a possibility, but you have to ask yourself why. I mean, she was in a 79 to 80 degree temperature sitting through a ceremony. That's just not normal to get overheated and hypotensive in a situation like this. It also begs the question, she's had other episodes where she's been dehydrated. You have to wonder, why does she keep getting dehydrated?
Well, we have talked before about other health issues that Mrs. Clinton has faced and that are a matter of public record. After the blood clot she suffered in 2013, she is on blood thinners and apparently additional prescription medication. Can this issue, in fact, be even more serious than pneumonia?
Well, absolutely. The bottom line is, if she had pneumonia, diagnosed on Friday, and she was started on the appropriate antibiotics, you would expect her to be at least somewhat improved by Sunday, not worse. So that kind of doesn't quite fit. The other thing is, if we're blaming her chronic spasmodic coughing episodes on the pneumonia, well, she's been doing that for, I don't know how long, 9 months, a year? That doesn't square with the whole scenario. Somebody with pneumonia, they have a pretty persistent cough, they have fever, they have trouble breathing, they're not walking around giving speeches. It just doesn't fit. And this is why so many physicians are coming forward more and more, because the facts that the Clinton campaign are coming out with don't make sense. And it's like an insult to our intelligence. The fact that they come out with this story of her having pneumonia 2 days later is also highly suspect. I mean, if she was diagnosed with pneumonia on Friday, why did they not send out a press release? I mean, it would have been an easy out for the Clinton campaign, and it would have potentially explained this episode. Now they've just really gotten themselves in a huge mess.
And Doctor, it's obvious that questions abound. And earlier today on America Talks Live, our Newsmax health editor, Nick Tate, raised some other serious questions about the state of Mrs. Clinton's health. Let's look and listen, and I'll ask for your reaction after we hear this.
Given her history with blood thinners, blood clots, she takes thyroid medication, she's clearly had problems with concussion and head injuries. It makes you wonder whether there might have been something else.
So, Doc, you heard Nick's question there. Can you answer? Is it something, in your opinion, that could be something that we haven't really heard about yet, and something far more serious than what the campaign is claiming?
Well, they've been extremely secretive, but of the things they've told us about the concussion. I doubt this is any effects of the concussion at this point. However, she also, through her physician, revealed that she'd had a right transverse venous sinus thrombosis, which is that blood clot in the major vein in the brain. That leads inevitably to some degree of elevated intracranial pressure, too much pressure in the head. That can affect the inner ears and give you bouts of vertigo that can present just like this, where the patient has a big autonomic response and they can't walk, they're diaphoretic, etc. And it almost makes me wonder, has she had episodes like this before? And that's why nobody in the motorcade seemed to be really worried about getting her to the hospital right away. If it's something they've seen 10 times already, well then, yeah, they're not going to go to the hospital the 11th time. But if this is a first-time thing, that's what surprises me, that she did not go to the hospital. But that is one other potential explanation. There's a whole bunch of other speculative things out there, but not knowing any more from the Clinton campaign, it's really impossible to say.
But we do appreciate your informed and educated speculation, Dr. Gerard Gianoli, tonight. Thank you so much for your time.
Thank you.
Now, coming up tomorrow afternoon at 1 o'clock Eastern on America Talks Live, we will talk illegal immigration with the president of the Federation for American Immigration Reform, Dan Stein. We'll update you on what's going on in the campaign, and we'll have your phone calls. Again, that's tomorrow at 1. Then tomorrow night on Newsmax Prime, conservative strategist Christopher Metzler, columnist Liz Peek, and Johnny Moore joins us to talk about continuing persecution. That's tomorrow night at 8. Hope to see you both times. Stay brave, stay free, stay tuned.